course director for ophthalmology. I'm the one that runs your course, and I'm the one that writes your multiple choice questions. Please turn on your cameras. We're going to be talking about non-infectious, and we're going to be talking about infectious. I know it looks like a lot, but we're just going to be covering things that are going to be important for you as a second year and for your multiple choice. Remember, we talked about adena, it means gland. So when we talk about adenoma, it means enlargement of the gland. Which gland are we talking about? We're talking about the pituitary adenoma, as you see it nicely here. Here's your gland. What's the closest structure to your gland? If the pituitary, your hair looks wonderful, Abdullah. Don't worry about it. Your pituitary gland, if it enlarges, it actually encroaches on your optic chiasm. And here you've got 1, 2, 3, 4, 5, and 6. So if you were gonna compress your optic chiasm, show me by your fingers. Is it 1? Is it 2? Is it 3? Is it 4, 5, or 6? Show me by your fingers. Yalla, everybody. Don't be afraid to make a mistake. Be afraid not to answer. Malik, I don't see your fingers. Everyone put them up. Very good. I see a lot of 3s, which means you guys have done your homework, which is very good. This is what we refer to as bitemporal. Bi meaning 2. Temporal, hemi, half, anopia. We're going to be covering a lot of that when you come to me, inshallah, in the 5th year. This is just enough to let you guys understand the concept. Thyroid eye disease, it's usually progressive. It affects the orbit. You get proptosis, as you see, or exophthalmos. It's the same thing. Exophthalmos proptosis. This is the hallmark of thyroid eye disease. You can see it here. Also, lid retraction. The lids have retracted. And then you get something called lid lag. When you ask the patient to look down, they will look down. One eye will go down. This eye will actually have a lid lag. Again, you get muscle engorgement. You see how big the muscles are? They enlarge. That's what causes the eye to bulge out, causing either the exophthalmos or causing what we refer to as the proptosis. And unfortunately, what else do you get? You get optic disc atrophy in the long run. So please, if you see any of your parents, God forbid, relatives, you're still a second-year medical student, soon you'll be a third-year medical student, please remember, take them to an ophthalmologist, because once they develop optic disc atrophy, you cannot reverse it. They will continue to be blind. Oh my God, Riyadh, Muzannara, the last is...
Yes, doctor.
What's wrong? You didn't change the back? You're still in the library?
Yes.
I'm going to let it go this time. I'm not going to. Just remember, you need a white background because it intimidates the interviewer. The reason I keep pounding you guys on this, because you will thank me. When you pass your interview and you're going to say, wow, I passed. That loudmouthed ophthalmologist really gave us some good points to remember. All right. And then this is unfortunately irreversible, and that's not something you want. Infections and syphilis, you get bilateral congenital cataracts. I think you see it here. This is an infant. Again, and syphilis, your macula, it's all pigmented. And candida and rubella, this is really unfortunate. Your whole pigmentation of the retina. Candida albicans, remember, you get puffballs. I can't tell you the importance of knowing your toxoplasmosis from the first cycle till the end. Please memorize it. You need it second year, third year, fourth year, fifth year. You need it in your internship. You need it for all your exams. Just please remember that. This is really very important to be able to know your toxoplasmosis. Diabetes, that's the closest thing in my heart. I don't know if you guys can see this. Let me turn it a little here. This machine here, this is what I do in Saddam. We actually go to the underprivileged areas, whether Saudis or non-Saudis, we don't care, as long as you're living in Saudi, and we examine you free. It's like Salwa has examined you and you never came to the King Faisal Specialist Hospital, simply by having this camera you see here behind me and sending it to all the charity centers. So why do I care about diabetes? It's the commonest cause of blindness in the developed countries. Now we are considered a developed country because we took all the bad habits of the West with all the fast food. The prevalence of diabetic retinopathy is 30%. Can you imagine, for every 3 people in this part of the world, our part of the world here, for every 3 normal people, one will be diabetic. For 3 diabetics, one will have diabetic retinopathy. And unfortunately, blindness can reach up to 5%. This is considered very high. It affects all your organs, as you see here. All your organs are affected. What do I care about? I care about the eye. You can develop cataract, and this is really unfortunate. You can develop non-proliferative diabetic retinopathy. I'm not going to dwell on that because you're still second year. You can, again, you develop hemorrhages, exudates, microaneurysms, and then you develop proliferative diabetic retinopathy, which is really very unfortunate when you have abnormal vessels. And then you develop from that vitreous hemorrhage, which is the end result, which will really cause blindness. And if the patient isn't seen immediately, he will be blind for the rest of his or her life. This is where Saddam comes in, goes to these underprivileged areas. We diagnose these patients when they're in the early stages and we treat them. All right, I think she can't stop moving, this Sana. I have to examine you, Sana. I'm taking you to my colleague, the neurologist. You're just too busy for me. My God, try to sit at least quietly for your exam. So the vitreous hemorrhage is really the end result. Hypertension, again, this is high blood pressure. What we get in hypertension is all these changes. You don't have to, but it's due to arteriosclerosis and and due to the vasoconstriction, which is really very important. But I just put it up for completion's sake. You have your skin diseases. I'm going to go quickly through them. Again, your mucocutaneous, your elastic. This is also very important. There is a multiple choice question. Where did Ahmed al-Jandali? He's here, he disappears. I mean, I gave him enough time at that point. I hope he comes back. And then of course, all these skin diseases do affect the eye and do affect the fundus. Always take a good family history. Ask about corneal diseases, glaucomas, cataracts, retinal diseases. Remember, there is something called autosomal recessive. We're going to be talking more about that, but if the mother and father are carriers, for every pregnancy, there's a 25% of being affected. There's also a normal, and there are carriers. Again, just to show you how the autosomal recessive, this is your oculocutaneous albinism, very unfortunate. And again, one of your autosomal recessive diseases. Please read on your chromosomal abnormality, trisomy 13, 15, and 21. There is a question on that. And again, remember, the eye is very delicate. And so you will develop a miotic pupil. When you see me going faster, it doesn't mean it's not important. It just means there's really not much for me to tell you about it. I like to concentrate on things you won't find in the books. Those of you that have not heard about phacomatoses, raise your hand. Yalla, everybody. Raise your hand so I can explain it more to you. So those of you that did not hear, and don't be shy, those of you that did not hear about phacomatoses, raise your hand, please. Keep them up, because I'm just trying to get, so it seems everybody raised their hand. Let's see. Oh no, she raised her hand. All right. So technically speaking, El Johra just turned on her camera. Hussein Al Ali, again, I'm not sure why he has his camera off. But what if I told you all of you have heard about phacomatoses? This is, by the way, autosomal dominant, because you've heard about neurofibromatosis, tuberous sclerosis, von Hippel-Lindau. This is just an umbrella term and all of you, I'm sure, have heard about neurofibromatosis. Let me just take a photo of those that didn't turn on their cameras, because this is really going to affect their graduation, which is really unfortunate. So this is your neurofibromatosis type 1. Please remember the Kapha-Lay spots, and they do develop what we call eyelid neurofibromas. These are the two common. If I was going to ask you, I would be asking you about the Kapha-Lay spots. Why is neurofibromatosis important? Because they can develop glaucoma, swearing, the thief of sight. Please remember that. They can also develop what we refer to as Lish nodules, and they develop cataract. So these are the four main in neuro. Now we're going to jump to Sturge-Weber. What is this here we're seeing? We call it the nevus flammeus, or what's the other name for it? Port wine stain. Very, very common. So Ragad al-Mazrua, is that it? ALMAZZRU. I don't like your camera. Please fix it. Ibrahim, what happened to Ibrahim? Kafshur, let me just take a picture so that I can document him. Okay, now he comes back. Don't disappear on me. No, all right, thank you. I just deleted the picture. Why do we worry about Sturge-Weber syndrome? Because they do develop glaucoma in 30%. Scleritis, remember we talked about conjunctiva, the white part of your eye. Unfortunately, when this is inflamed, you see this in herpes zoster, you see this in sarcoidosis. Look at how bad that looks. This is your scleritis. This can really cause a devastating eye disease, which can lead to blindness. Really very important. Rheumatoid arthritis also can affect both eyes from the systemic disease, which is really bad. Then, of course, you have your HIV infection. We're going to be talking more about that when you come in the 5th year. I'll be telling you some really nice, well, I wouldn't say nice stories. I'll be telling you some stories that will really explain to you what HIV, but I just put it up because it occurs in 70%. The hallmark is cotton wool spots, hemorrhages, CMV retinitis. The most important thing, if you do get a multiple choice question, you get a Kaposi sarcoma, tumors of the eye. Again, this just shows the hemorrhages. This shows the CMV retinitis, cytomegalovirus. Who is this? Heya, wow. Heya, maybe I should bring you a hubbly bubbly and bring you some nice coffee just to match your seating. Then you have your cytomegalovirus retinitis. You see it nicely here. And then remember Kaposi sarcoma. This is very common, very, very common with HIV infection. So if you get a multiple choice question, which sarcoma are important in HIV, you're going to write Kaposi sarcoma. We talked about herpes zoster. I keep repeating it because it's very common in the exams. Remember, we said it respects the midline, as you see it nicely here. And then what do you get? You get your dendritic keratitis, which is shown nicely here. We keep repeating it because it is really important. Noura al-Sara. I don't know what the last words. 689, turn on your camera, please. Hussein Al-Ali still doesn't want to turn on his camera. Very good. All right, here's your anterior segment systemic disease and Wilson's disease. You get Kaiser-Fleischer ring. Cystinosis, you get the cystine crystals. Hypercholesterolemia, you get the cholesterol ring. I think you see it very nicely here. Galactosemia, you get the cataract. Myotonic dystrophy, you get the cataract. Down syndrome, do you see them here? You get the nice brush field spots. And posterior segment and systemic disease, again, really very important. You get, as you see very nicely here, papilledema. Here's your metastasis here. Cell disease, I'm going to be telling you a beautiful story, inshallah, when you come in the 5th year, past my FCS with the sickle cell disease. And this is your hyperviscosity syndrome. You see it very nicely here. Ali Al-Ajami decided to turn off her Why do you turn off and then come back on? And again, Hibatallah Hassan decided to turn off his camera too. Why do you turn off Hibatallah and then you come back on? What's happening? Please have your camera on. If you don't have your camera, you're absent.
Okay.
Dry eyes is really very important. That's what we call the Zika syndrome. You really look at this. I know it's just a simple dry eye, but look at the discomfort. This is what we call the Schirmer test. We always like to use the lubrication. Really very, very important, this lubrication. And this is what I like to use. I hope you can see it. It's actually the Minims. Really, really important to be able to use it on. I always, as you see, I have it in my pocket because we tend to read a lot, concentrate a lot. I always use it to make sure my eyes are always lubricated. Marfan syndrome, I think most of you have heard about Marfan syndrome. This is really very important. It's a genetic disorder of the connective tissue. Again, it's autosomal dominant. And look at the way the patients look. They're very tall. It was so interesting. I treated someone with Marfan syndrome. It was him and his mother because it's autosomal. So it goes from mother to son, father to son, whatever. It's autosomal dominant. So the parents have it, they transfer it, and he went into medical school. I gave him so much confidence in himself that he actually and is doing really very well. What do you get? This is your normal red reflex. What do you get in Marfan syndrome? You get a subluxated lens. Do you see it? How does your lens subluxate? Please remember this. Supratemporally, your nose is here. And look at this. You can always remember it by this is a Marfan syndrome. He's holding his hands up. So when you get a multiple choice question, my God, Heya, I love her. She's sitting in a cafe. My God, you wouldn't do well in your interview if you sat like that. So this is your subluxated lens. Usually you see it subluxated. Remember this, supratemporal. Please remember that for your multiple choice. It's really very, very important. Okay. Let's talk about giant cell arteritis. This is one of the biggest mimickers. Here you have inflammation of the medium-sized blood vessels. Usually it's related to polymyalgia rheumatica. You have vasculitis of the arteries, head, face, and eyes, and the blood supply, unfortunately, is affected. What do they present with? Look at this. Does this have anything to do with the eyes? Right? Nothing to do with the eyes. But the only people that can treat them are the ophthalmologists. So if someone complains in your family of scalp tenderness, continuous headache, they will tell you when we chew, it really hurts us. They're always complaining of polymyalgia. They have fevers, night sweats, and they're losing weight. Please think of giant cell arteritis and bring them to the ophthalmologist. I know it sounds weird. Why? But the reason is because we have to do a biopsy. So when these patients show up to us, we really do a biopsy. And this is when you look into their fundus. What do they have? Really unfortunate, they have papilledema. And this is it. When we do the biopsy, this is how we're able to diagnose it, that this is giant cell arteritis. And we pump them with steroids. And we pump them with steroids big time. Omar Salim, wow. I could practically take a photo of you. Wonderful. Wonderful. I'm really proud. Myasthenia gravis. Remember when we talked about the ptosis, when we talked about it in the third nerve, you also get the myasthenia gravis. You do get the ptosis here. It can affect any muscle. And this is what you get. You get the ptosis. I think you see it here. But it's a mild ptosis. It's a very mild ptosis at that point. And you get a lot of ocular motility disturbances. And what's unique about the ptosis and myasthenia gravis? What will they tell you? دكتورة قمت الصبح ما فيني إلا العافية. I woke up in the morning, I was perfect. ما يجي يا دكتورة آخر الليل إلا شو اسمه إلا عيني طبقت. At the end of the day, my eye closes. This is what happens. So it's variable. It starts in the morning. Hussein al-Qattan, what do I do with you? Do I kill you? Do I bring your camera closer? Why is it so difficult? بيجنني هالولد. So technically speaking, then your eye, you get the ptosis. So what's unique about myasthenia gravis? The variability. Okay, there's variability in the presentation. Please remember this is a multiple choice question. The eye signs actually occur in 50%, and this is really very, very important to remember that. Mustafa, even though I love your jacket, it's wonderful. Thank you for wearing it, but you keep looking down. Make sure you don't do that in your interview. I swear to God, it will affect you. So what you have to remember about the ptosis is the variability. This is really very important. This is practically our last slide from the Usher's syndrome. I'm going to finish a little earlier because I'm going to leave the floor now open. Whoever has a question can ask, because I saw some questions in the chat, and sometimes the questions are just as important as that. So Usher's syndrome, which we call the Lawrence-Moon-Beadle syndrome, there are two. Usher's syndrome, this is unfortunately when they're obese, they have retinitis pigmentosa. I'm considered a leading figure in retinitis pigmentosa worldwide. I do a lot of the retinitis pigmentosa, and additional to the diabetes, they're usually obese and they have an extra digit. And then here, again, Usher's syndrome, unfortunately, they are not able to hear. So they have both peripheral night vision difficulties. For these patients, they have an extra digit. For the Usher syndrome, they're really unfortunate that they do have hearing difficulties. I'd like to stop